Good morning. You're listening to Insurance Matchmaking, the show centered around health and life insurance issues, especially Medicare coverage. This is Insurance Matchmaking with Matt Libby Insurance.
All right. Welcome back to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And I'm going to focus now a little bit more on some of the things with Medicare and with Social Security. So one of the things that I thought of on my last show was talking about, a young family and that sudden death of the young father. And one of the things a lot of people don't realize that there is some Social Security benefits that you can get for those kids. So if you did lose someone who's recently lost a spouse, definitely encourage them to get in touch with their local Social Security office, that there are benefits they're entitled to based on how long that individual has worked, and they have paid into the Social Security system, and that can definitely come in very handy. I can use the example. My wife, her first husband passed away prior to the age of 40, and she had 2 young kids to raise, and fortunately was able, and he had life insurance too. So he had the life insurance. She was able to pay off the house and pay off some debts and still be a stay-at-home mom because the money was coming in from his Social Security benefits to benefit the children. And so it was great that she was still able to be there, to be that mom when the kids came home from school. So it really helped out a lot there for her and our kids. I've been their dad for quite a while now, so it really helped out for us to be able to know we had that security for them and still move forward with what we're doing. But the other thing I wanted to talk about that I run into, that I've encountered with doing my under 65 health insurance when I'm working with people on their ACA plans, and especially when I talk to like young people working in the restaurant industry as servers. And we all want to avoid as much taxes as possible. So we know that not all tips get reported because, we don't want to pay tax on them. But depending on where their income is, they may be actually hurting themselves rather than helping themselves by trying to avoid those taxes. The ACA plans, that it's based on, if you have a low income, then you get the maximum subsidies to help pay for that health insurance, but there's a minimum income. And that's what I've ran into. I had a couple of clients that were just under the limit, and I'm like, that's an easy fix. You just need to report a few more of your tips, and you'll be over that limit. And then they got their health insurance basically for free, versus they would have had to pay, $400 a month or something like that, because they were young, but they were going to have to pay for their insurance because they weren't eligible for the subsidy. So it really makes a big difference. The other thing that comes into play is Social Security. So I deal with a lot of folks on their later years that they don't have much money to pay for their health insurance, or because they're barely living, because they're on that fixed income and it's a very low income. And that again goes back to, depending on what you're paying into Social Security, how much you're going to be able to draw when you do hit that retirement age. So it's very important to make sure that, you are being accurate. And of course, hopefully, as your working years, you hope you're earning more year over year. And that's what puts you into that situation of, when you do retire, how much you're able to draw from your Social Security because of the amount that you paid in. It's not the same amount for everybody when they reach that Social Security age. And I think that sometimes maybe is a misconception on younger people, and not just and I say younger people, not just, when they're young, but maybe when they're in their 40s and 50s, thinking, well, just once I hit 62 and I can start drawing my Social Security, then I'll be set. But if they haven't paid much in, or they've done work under the table, and again, you're saving on the taxes, but if you're not paying into your Medicare and your Social Security funds, you may not have all the benefits that you think you're going to have when you turn 65. So as they say, honesty's the best policy. That's kind of the way to go. Just kind of make sure that you're being honest, reporting the income that you earned, and in the end, it will pay off. So I run into that a lot. The other thing is make sure you're paying into your Social Security, because if you have years where you're doing self-employed, you're not reporting income, and that's not getting counted towards your retirement, it's also not counting towards your Medicare, because to be eligible for your Social Security and to be eligible for Medicare when you turn 65, you have to have 40 quarters, is the way they divide it up, of paying into your Medicare and Social Security fund. And the reason they say 40 quarters is because it doesn't happen all at once, but it's equivalent of 10 years. So 10 years of and it doesn't necessarily be your adult life, because you can start paying in, you can get a job at 14 some places, and 16 where they start taking the money out of. So that time counts. Another thing a lot of people don't realize is if you're in the military, like I was, you pay into Social Security. Even when you're stationed overseas, you're paying into Social Security, you're paying income tax. I think a lot of people, if you're in a combat zone, you don't pay income tax for your income in that combat zone. But like when I was stationed in Germany, I had to pay income tax. I still had to pay into Social Security. But that all counted in, and that's all going towards my retirement when I do start drawing Social Security. If you're already drawing Social Security, when it comes time for Medicare, they're just going to send that Medicare card. You don't have to jump through hoops to get it. So it does help people that way get started going on what they were going to have. But I've run into sometimes there's still a few teachers out there that paid into a teacher retirement system that didn't pay into Social Security. So a lot of them in later years now have paid into Social Security, but so they're getting their Medicare benefits and such through Social Security because they've paid into it. So it is very important to pay into that Social Security fund to make sure that you're going to be able to cover your health care. Unless you're filthy rich, as they say, then you won't have to worry about it. But the majority of people are going to be, hey, I can't, and healthcare costs just keep going up. So you're going to want to make sure that you've set up your Social Security benefits and paid into the system so you do get those benefits when you hit that age. So if you got questions on that, just let me know, and we'll cover that as best we can. I'm not a Social Security specialist, but since doing health insurance since 2013, I've come to understand it a lot more, which helps a lot. And we're weighing our options at home of when do we start drawing. I'll be 65 this year. My wife turned 64 this summer. So I'm still working. She's not. So she may go ahead and start drawing her Social Security. I'm probably still going to have to wait because I would just be giving the money right back to the government. So there's no point of drawing it early. And like I said, I'm not the Social Security expert to help you kind of figure out when is the best time to do that. Again, that's something I would point you to someone else that does have that kind of expertise. So that's kind of on the Social Security, talked a little bit about the Medicare, talked about the Affordable Care Act plans. The other thing is a lot of people had like 10 care benefits, or their children had the Children's Health Insurance Program, and they're getting notices that's going away. That was one of those things that during COVID, they didn't reevaluate the income. So people who maybe were getting Medicaid benefits when COVID started or during COVID, they got approved for that. Now they're working, they're making above the income limit. They didn't cut those benefits off. That started this spring, that they're now going to go ahead and reevaluate that. People who had been on TennCare for years knew that every year they had to submit information to update their income to keep their benefits. And if they didn't send in the update, they would get the notice, hey, we're cutting your benefits off because you didn't update, and then they had to scramble to get that information in. So a lot of people who were getting some of those benefits for them and their children, they call it the Medicaid unwinding. And so that's going to hit a lot of people coming up on their finding out that they're not able. The good news is that does give you a special enrollment to get a health plan that you can sign up because it's not open enrollment. So that's one of the things that you can do, and that's something we can help with. The other thing is that I talked about earlier of that minimum income to qualify for the health credits, and that is cut off at what they call 100% of the poverty level. So if you earn below that dollar amount, that's when they say you are poverty stricken. That's 100%. But you can earn above that 100% and up to 150%. You can get a special enrollment time to enroll in a health plan, even outside the open enrollment period. You don't have to qualify other reasons for a special enrollment, like you just lost group coverage or you just got married. There's a lot of different ways. You just had a new child. Those are all life events that will give you a special enrollment. But if you're below that 150% of the income, but above the 100%, you can qualify and get that health insurance also. So hopefully that's a way you can get health insurance that way. And then we're going to go into the break here, and then I want to talk a little bit about the upcoming Medicare enrollment and kind of touch base on some of the things that happens there. So we're going to take our quick break and right back, and we're going to talk about getting ready for Medicare enrollment.
A power outage can not only be an inconvenience, but it can be dangerous. Cove Generators is your premier Generac home standby generator dealer, and they offer service and repair on all brands of residential and industrial generators. Be prepared for the next power outage. Call Cove Generators to inspect and perform maintenance on your Generac automatic standby generator or any brand of generator that you own. Visit covegenerators.com and never lose power again. Or give them a call at 931-559-3311. covegenerators.com.
Get a great deal on versatile Kubota equipment today, like Kubota BX and L Series compact tractors, part of our tractor lineup rated #1 in durability and owner experience, Z Series mowers, and Sidekick utility vehicles. Stop by your local Kubota dealer today. Bring home select BX Series equipment for 0 down, 0% APR for up to 60 months, plus save up to $800 now through September 30th. See us or go to KubotaUSA.com for more details.
See Sam, Tim, or Alan Brown at Hicks Brothers Tractor Service on South Jefferson Avenue in Cookeville. We're your locally owned Kubota dealer.
Are you booking your next beach vacation? While you're at it, book your dog's next staycation at Dog & Company. They're never crated. Multiple play areas, toys galore. Friends, your pups will love their staycation at Dog & Company. Plus, someone is always with them, which gives you a peace of mind while you're away. Book your pup's next staycation at Dog & Company, 528 Bark or Jefferson Avenue, Cookeville. Dog & Company. Enjoy life and spoil your pets.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, well, we're back, and we're going to talk, like I said, about the upcoming Medicare enrollment season. As this recording, we are in July of 2023, just to kind of set that date, because might replay this one later down the road. But we're coming up on what's called the annual election period for Medicare. I'm in the process right now of doing my recertifications. I have to recertify every year. There's a test that we get from the government that's called the AHIP, and we have to take that every year to be able to be eligible to offer Medicare Advantage and Medicare Part D plans. And then we have to do certifications with each of the carriers that offer those plans. And we have to do that every year. And in fact, even if I decide to stop selling, if I do not take those certifications, then I will stop earning on the renewals on those plans. So even when I retire, I'm going to have to fully retire, I'm going to have to take those certifications to keep my income coming in. So that's on my end. But what I wanted to build up on that is when we're coming up on this election period, it starts in October, and the actual enrollment period is October 15th to December 7th, and those dates are set in stone. It's always those dates every year. It ends on December 7th every year. Doesn't matter if it's a Saturday, a Sunday, a Wednesday. December 7th is the deadline to change your plan to be enrolled in a plan on January 1st. The reason I say that is it's not like taxes where Monday's a holiday and it rolls, and then, instead of being April 15th, it might be April 18th is the deadline because of where it falls during the week. The Medicare deadline is a set date. And then we also have in October, the first 14 days of the month is what we call the pre-AEP. And the reason I bring that up is I start getting my materials from the insurance companies, usually that last week of September, sometime after the 15th of September, I'll start getting the materials for those plans, and I can see the plans. I'm not allowed to share the changes of the plans or what the plans entail to what Medicare calls you, if you are on Medicare, a Medicare beneficiary. I can't share those details with you before October 1st. So it gives us a couple of weeks to kind of shop plans, reevaluate a plan that will fit for you, but I can't take an application during that time. I still can't take an application until October 15th. So what I like to try to do every year with my clients is we need to update. One of the biggest parts of seeing if a plan fits for someone or not is their drug coverage. And whether you have a Medicare Advantage or you have original Medicare with that Medigap and add a drug plan to that. The Part D of Medicare covers the drug coverage, whether it's with a Medicare Advantage plan built into it or it's a what we call standalone PDP or prescription drug plan. The rules are the same for those drug plans, but each company has different amounts that they'll pay for certain drugs or whether they cover a drug or not. They have to cover a certain class of drugs, but maybe the prescription your doctor is prescribing may not be covered by this plan, or that plan. So we want to reevaluate that drug coverage. So we try to do that every year, and I ask my clients to kind of start sending that stuff to me in August and September so that on October 1st, I can do that comparison and then get back to them and just say, oh, double checked. Everything you take is still going to be basically the same. If everything's worked fine with your drug plan, we don't need to change it. And that's the same thing, with the Medicare Advantage plan. Because sometimes they'll change they'll drop a drug off their formulary or they'll move it from one tier to another. Now, if they move it down a tier, that's a good thing. But unfortunately, sometimes they move it up. And those tiers are based on tier 1 is your least expensive drug. In fact, a lot of plans, if that's on their tier one, there may be no charge. There may be no copay for that prescription. Your drug plan pays 100% for it. Tier 2, it's probably still a generic, but you may pay $10 or $15 for that generic because it's on tier 2. Now, what happens a lot of times, those tiers aren't necessarily specific to whether they are generic or brand name. You can have a brand name drug on tier 2, or you can have a generic drug on tier 3, which is tier 3 is typically your brand name drugs. So what happens is maybe a very expensive generic may still fall under the tier 3 because you have to pay that higher copay that you would pay on a brand name drug. So there's 5 basic tiers, and as I mentioned, from tier 1 to tier 5, how expensive those drugs are going to be. The other thing is, if you have a lot of prescriptions on tier 3 or higher, you're probably going to also encounter what they call the donut hole. That is the Part D coverage gap. So we'd like to try to make sure, because it makes a difference a lot of times on your drug plan whether you're going to go into that coverage gap or when you're going to go into that coverage gap, because it's based on the cost of the drug. So switching plans may make sense because we want to look at your overall costs are going to be. And that's one of the things I try to stress to people when you're especially looking at a standalone drug plan. They have different monthly premiums. You can have one right now. There's one that's $7.50, and then there's plans that are $100 and something. But believe it or not, depending on what your prescriptions are, that $100 a month plan may save you hundreds and even thousands of dollars over the year on your drug costs. So we really need to look at what your prescriptions are to see what those are. So I ask anybody if they're thinking about maybe changing their drug plan is to let us know, get us a list of your drugs. We have a form set up online. We can give you a link. You go in and you fill out. It's a secure site. You fill in the information and then we can download that as a PDF and take that information and then shop your drug plans and say, oh, you have this plan, but if you switch to this plan, it's going to save you $200 a year. So that can make sense. And so I can do that. If you do not have to be one of my clients to take advantage of that service, but if it makes sense for you to change your plan, then you would become my client. But it is a free service we provide to evaluate whether your prescriptions are going to be covered well on that plan you still have. And unfortunately, a lot of times I have to turn around, especially if you're not already my client, is say, well, I would love to get your business, but your best bet is stay right where you are. I will share that with you and not think twice about it, because I want to make sure you're well taken care of. The other thing is, a big part of my business is getting referrals. And I treat you right, you're going to tell people I treated you right, versus if you feel like I just kind of confused you to get you to sign up for something, or bamboozled you. I'm not going to do that. And if I've mentioned, I've said we here, my assistant Bree, who is licensed, she is working on her certifications too, and so she will be approved here soon to be able to offer Medicare Advantage and Part D prescription drug plans also. But if you want to get some life insurance, under 65 ACA insurance, dental plan, any of those plans, a Medicare supplement, Bree can help you with that also. So it doesn't have to be me. If you call the office, you don't say, hey, I need to talk to Matt. Just say, hey, I'm looking for help on my plan. Bree is normally going to be the one who answers the phone, and she can help you out on that. If she's not really sure what your solution is, believe me, she's going to ask me. She's going to get information from, and use my experience to help her help you. So we both work hard on that and work well together doing that. So hopefully we'll be able to do that. Like I said, you can go on the website. There's actually links on my website that you can click on and go to get that form and fill it out to give us that information. So that's one way to do it. Or you can, call or come by the office, or we can send you a form. If you call and say, well, I really don't do the internet, can you send me a form, and I'll fill out the form and bring my list. However you want to do it, we can do that. And we ask, and that's why we're kind of asking for people to give us the list, because that's going to be the hardest part. Now, the other thing on the Medicare Advantage plans, who your doctor is very important. Now, what doctors you're seeing, and sometimes those doctors change networks, so sometimes you do need to change plans. But the great news is, if you have a Medicare Advantage, it's not just that Medicare annual election period that we have to take care of your Medicare Advantage plan. So if you're not, if everything's going fine with your Medicare Advantage plan, and you don't have to have it changed for January 1st. We have another election period the first 3 months of the year that's called the Medicare Advantage Open Enrollment. And we do have a one-time shot to change your Medicare Advantage to change to another plan starting the first of the next month. So from the January 1st to March 31st, you can get a plan that will start February, March, or April 1st. And I bring that up now because during that period, I'm not able to market that special election period and say that you can change your plan. But just to let you know, if everything's fine with your plan, you don't have to change it for January 1st. But sometimes what happens is you go to the doctor then towards the end of January or first part of February because you haven't been in 6 months, and they say, oh, we're not taking that plan anymore. That's not going to help you that day, but you get a hold of me, we can get you on a plan that they do take that will start at the beginning of the next month. So that's one of the things we can do on that with the Medicare Advantage. The other confusion that I run into a lot are people who are turning 65, because I work with a lot of them. They think that December 7th is a deadline for them. That December 7th deadline is for people who already have Medicare plans. They already have a drug plan, or they already have a Medicare Advantage. It's the annual election period. It's not an open enrollment for someone new to Medicare. So maybe your Medicare is supposed to start in December because your birthday's in December. You don't have to hurry and get it done before December 7th. You have that 7-month window of when you turn 65. Using the example, my birthday's in December, so I can use that example. September, October, November, 3 months prior to that December 1st, because it's not based on, it's based on your birthday, but it's the first of the month of your birth month. And again, one exception to that is if your birthday is the first of the month, it will back up 1 month earlier. So like if your birthday was December 1st, your Medicare would actually start on November 1st. So that means you can start the process in August. But to keep it simple, you have a 7-month window based on your birth month. So for a December birthday, you can sign up for a plan from September through November to start December 1st. And the other thing is, and then also January, February, March, you can do, if you haven't used that initial election yet. The other thing is you can sign up for a plan for December 1st, and then during the annual election period, you can change that plan for January 1st because there may be some changes. Now, generally, when I'm working with someone, I'm going to try to find a plan that they're starting on December 1st that will be the same plan they'll be on January 1st. And that's the great thing of I can do that in October. But if we sign you up in September, we may need to relook at it during the annual election period. But when we do it from anytime October and on, we can look at your plan and plan it for, that'll be the same plan you have in January. So again, that's just kind of that explanation of the election period. And there's a lot of other different election periods. There are, as I have mentioned on an earlier program, we currently have 3 companies in the state of Tennessee that have 5-star plans. And those 5-star plans gives you it's a great bonus for the insurance company is because they can sign you up for their plan anytime during the year. And you don't have to have a Medicare Advantage plan to take advantage of that 5-star. You could have missed an enrollment period, or you just decided, and never signed up for a plan, or you want to change your plan, then you can go ahead and sign up for that plan using the 5-star. So, for example, I'm recording this in July, but you can sign up and the plan will start the first of the following month. So as long as you sign up before July 31st, it'll start on August 1st. If you come to my office on August 1st, say, I want to get that one, I want to start it today, it will start the 1st of September. Whenever you sign up for a Medicare plan, it starts the 1st of the following month. And I mentioned that open enrollment, that the first quarter of the year, January through March, you have to have a Medicare Advantage plan already to take advantage of that enrollment period. You can't, if you don't have a Medicare Advantage plan, you can't sign up for one then using that special enrollment. Now, if it's the 5 stars I mentioned earlier, yes, you can. But the 5-star does not require that you already have a Medicare Advantage plan. You can only use it once, but it is a plan that you do for that time period. So I wanted to cover all that. I know threw a lot of information at you today, but don't forget insurancematchmaking.com. Phone number is 931-881-3969, and we're at 528 North Willow. Basically, straight across from the hospital, a few blocks over, but when you walk out our front door, you're looking at the front door of the hospital. So that kind of give you an idea of where we are on Willow, and look forward to meeting you if I haven't met you yet, and give us a call and let us know how we can help make your insurance match. So have a great day, and we'll talk to you again next week.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.